Hello, I'm Heather Walke with DentistryIQ.com. This week we'll be talking with Dr. Joe Blaze, the editor of Dental Economics, about the magazine's technology issue. We'll also be speaking with Diane Watterson regarding her column about a disagreement between a doctor and a hygienist about the periodontal treatment of a smoker. In conclusion, I will also want to bring you shoppers up to speed on some bargains you may find on DentistryIQ.com. First, if you're a subscriber to Dental Economics magazine, you should be seeing the August issue of DE in your mailbox anytime now. August has become the technology issue for DE, and this year is no exception. We recently caught up with Dr. Joe Blaze, editor of Dental Economics, to get his August highlights.
I'd also like to call your attention to a new column that's starting this month in Dental Economics by a good friend of mine from Clearwater, Florida, Dr. Bill Strupp. I've been trying to get Bill to write in my magazine for a long time now, and at least a couple of years, and now he's finally said yes and is going to be there on a regular basis. I think you will really enjoy the comments that Bill has to make about why you are who you are in terms of dentistry and how to be really successful in your practice, along with some really great clinical tidbits as well. So be sure to check out Bill's column. I know you'll get a lot of good information from his writing, and I know you'll enjoy getting to know him. I have a really great article for you from Alan Schiff, who's a CPA from Baltimore, Maryland. He has an all-dentist practice, so he really knows dentistry and knows the ins and outs of the tax laws and so forth and so on. His article is really very interesting for you because this is probably a question that's asked more than any other. When do I integrate this new technology into my practice? When will it be profitable for me to do something like that? So Alan's article is titled 10 Steps to Integrating New Technology into Your Practice. And I know if you follow these 10 steps, you're going to be in really good shape in your quest for technology and dentistry.
In her September Staff RX column, Diane Watterson writes about the interesting case of where a dental hygienist balks at the proposed treatment of a dentist. The case involved the periodontal treatment of a smoker, and Diane describes the case for us.
And sometimes they don't agree with the doctor's diagnosis, particularly if they feel that diagnosis is an overdiagnosis of the case. And I think that was the situation here. This patient did not have heavy bone loss and such. There was some very slight bone loss, but there was a little bit of bleeding. And there was the fact that the patient's a smoker. Now that's a big fact because smoking can mask periodontal disease. And you know, sometimes I think hygienists get so calculus focused that they think their major goal is to remove the calculus. Well, if the patient didn't present with a lot of calculus to start with, then a hygienist would be tempted to say, well, this case is not a periodontal case, or this case really does not warrant definitive periodontal therapy. But in this case, I think that I do agree with the doctor's diagnosis. This is a difficult one, Mark, because this is a patient with not really overt, serious periodontal disease, but an early periodontitis.
Diane also offered this advice on how the dental team can discuss periodontal diagnosis with patients.
If a doctor is unsure if this is a type 2 or a type 3 case, it's better to call it a type 3 and then to say to the patient after it's discovered it's really a type 2, then to say to the patient, you know, well, good news for you. This wasn't quite as hard as we thought it was going to be. This is actually not going to be quite as much money as we thought it was going to be either. And that's good news to a patient. Whereas if they underdiagnose the case, then if it turns out that it's a lot more difficult, then it's difficult to come back to the patient and say, well, you know, this is going to cost more money than we thought originally. Patients don't like that at all.
Be sure to look for these articles in Dental Economics and RDH magazines. Finally, DentistryIQ.com is not just an information source for dental professionals. You can also do a little shopping there. For instance, how about having free samples delivered right to your mailbox? When you're on the homepage for Dentistry IQ, look for this box and click on it. As you can see from this photo, Waterpik and Crosstex are offering samples of fluoride varnish and prophy paste, but there are others not visible in this photo for samples of sensor holders, whitening kits, exam gloves, and other home care and in-office supplies. Follow the links to receive your free samples. DentistryIQ.com also offers classified advertising that can be viewed by website visitors. Look for Marketplace in the menu bar at the top of the homepage and click on it. You can also view some of the classified advertising at the website. In this photo, you can see some listings for dental practices for sale as well as employment opportunities. Thank you for joining us on DentistryIQ.com. I'm Heather Walke saying goodbye until next week.